Hello friends, welcome to Quikdentistry, solution for your dental subjects from first to final year. Subscribe the channel to learn your subjects fast and don't forget to press the bell icon for new video updates. Hello students, today we are going to study about thyroid gland. Thyroid gland is an endocrine gland present in the neck in front of second, third and fourth tracheal ring. We will study the anatomy of thyroid gland in another video. Here we are going to discuss it in general surgery point of view. यहाँ हम सिर्फ जनरल सर्जरी पॉइंट ऑफ व्यू में ही पढ़ेंगे, जैसे कि थायराइड ग्लैंड की डिजीजेस के बारे में जानेंगे, उनके एग्जामिनेशन के बारे में जानेंगे, साथ ही साइंस एंड सिम्टम्स भी देखेंगे. Thyroid gland is an H-shaped gland consisting of right and left lobe and an isthmus. Thyroid gland secretes triiodothyronine and thyroxine. Thyroid function test. Serum T3 should be 1 to 3 nmol per liter and serum T4 should be 55 to 150 nmol per liter. Serum thyroid stimulating hormone should be 0 to 5 international unit per ml of plasma. Serum creatinine is increased in hyperthyroidism and decreased in hypothyroidism. Serum cholesterol is increased in hypothyroidism and decreased in hyperthyroidism. Serum calcitonin is increased in medullary carcinoma thyroid. Other thyroid function tests are thyroid autoantibody levels and thyroid scintigraphy. Now let's check the level of T3, T4 and TSH in following disease. Here the small I denotes slightly increased, capital I denotes increased to a larger level, L for low and N for normal. Now let's study the clinical examination of thyroid swelling. If it's of long duration, it is benign. If it is of short duration, it is malignant. Rate of growth. Slow growing may be benign. Rapid growth may be malignant or malignancy developing in a benign lesion. Now what is dyspnea? It is shortness of breath due to infiltration into the trachea, lower border not seen, tracheomalacia and cardiac failure. Thyroid swelling causes hoarseness of voice, which occurs in carcinoma thyroid infiltrating recurrent laryngeal nerve. What are the toxic features of hyperthyroidism? CNS symptoms such as tremors of hands, sweating, CVS, palpitation, GIT, diarrhea, menstrual disturbance. Symptoms of hypothyroidism: poor appetite, abnormal deposition of fat, intolerance to cold, failing memory, deep hoarse voice and lethargy. Sudden pain, thyroid swelling and fever suggest autoimmune thyroiditis. You should always take past history. History of medication in past may be toxic goiter. If there is previous surgery history, then it may be recurrent goiter. You should ask about family history. It may be an endemic disease because some of the areas are deficient in iodine. हम थायराइड केसेस में जनरल फिजिकल एग्जामिनेशंस कैसे करते हैं ये देखते हैं. ग्रेव्स डिजीज के लिए आई साइंस और ट्रेमर्स ऑफ टंग एंड हैंड देखते हैं. पल्स रेट इंक्रीज या डिक्रीज देखते हैं. ग्रेव्स डिजीज में हम प्रीट्रिवियल मिक्सोडीमा चेक करते हैं. कार्सिनोमा थायराइड में बोनी टेंडरनेस. सेकेंडरी थायरोटॉक्सिकोसिस में ब्लड प्रेशर चेंजेस देखते हैं. During palpation test, we check for local rise in temperature, consistency, intrinsic mobility test, sternomastoid contraction, position of trachea, palpation of lymph node, pulsation of common carotid. Some of the special tests are Kryl's method, Lahey's method, Prislow's method, Koch's test. Percussion over sternum gives resonance in normal case. In retrosternal goiters gives dull note. Auscultation is done at the upper pole of thyroid gland. Definition of goiter: diffuse enlargement of the thyroid gland. Diffuse means involving the whole gland or a larger area. Now let's study about classification of goiter. Question ऐसे भी पूछ सकते हैं कि classify thyroid swelling. So don't get confused in that. Let's begin with classification of goiter. It has 5 types. So the first one is simple goiter. Second one, toxic goiter. Third, neoplastic goiter. Fourth, thyroiditis. And fifth, other rare causes. So simple goiter types are puberty goiter, colloid goiter, iodine deficiency goiter, and multinodular or commonly known as MNG. Now types of toxic goiter is Graves' disease, secondary thyrotoxicosis in MNG, third one is solitary nodule, and fourthly other causes. Now neoplastic goiter, it can be divided into primary and secondary. So primary can again be subdivided into well differentiated, poorly differentiated, arising from parafollicular cells, both arising from lymphatic cells. Next is secondary metastasis. Metastasis means spread due to the primary source. So under primary comes well differentiated, जिसके अंदर आता है papillary carcinoma and follicular carcinoma. Poorly differentiated में anaplastic carcinoma, arising from parafollicular cells के अंदर में medullary carcinoma, arising from lymphatic tissue में malignant lymphoma. Under secondary metastasis, that is spread from the thyroid gland due to blood spread, आता है malignant melanoma, renal cell carcinoma, breast cell carcinoma, now under thyroiditis comes granulomatous thyroiditis, autoimmune thyroiditis, and Riedel's thyroiditis. Under other rare causes में acute bacterial cause, thyroid cyst, thyroid abscess, and myeloid goiters. Summary: in this lecture we learned hormones secreted by thyroid gland, various thyroid function tests, goiter definition and classification, how to examine a thyroid patient. In our next video lecture we will discuss thyroid diseases in detail. Thanks for watching.